3 patients walked through my door last Tuesday. All of them had the same complaint. They'd been walking faithfully for months, sometimes close to an hour each day, and instead of feeling better, they felt progressively worse. Sharp pains in their hips, swelling in their ankles, exhaustion that didn't match the effort they were putting in. I'm Dr. James Whitemore, and I've spent the last 18 years treating patients who thought they were doing everything right for their health, only to discover they were slowly breaking their bodies down, one step at a time. The question I always ask is simple: show me exactly how you walk, and what I see next tells me everything I need to know. Because here's the truth nobody wants to hear. The problem isn't that you're not walking enough. The problem is that you're walking in a way that's destroying your body from the inside out. Hit that subscribe button right now, because what I'm about to share with you won't be covered in your next doctor's appointment. The healthcare system doesn't make money when you stay healthy. It makes money when you keep coming back. Let's make sure that doesn't happen to you. So why does walking matter so much after 50? Because at this stage of life, your body undergoes a profound biological shift that you can either work with or ignore at your own risk. Let me break down what's actually happening inside you right now. Your muscle tissue is disappearing at an alarming rate. This isn't speculation, it's called sarcopenia, and it means you're losing between 1 and 2% of your total muscle every single year after 50. Do the math over a decade, and you're looking at nearly 20% of your muscle gone. And muscle isn't just for lifting heavy things. It's what keeps your joints stable, regulates how your body processes sugar, and prevents you from losing your balance when you stand up too quickly. Lose that muscle, and everything else starts to unravel. Your joints are stiffening. The cartilage cushioning your bones doesn't have its own blood supply. It depends entirely on movement to receive nutrients. Every time you move, a fluid called synovial fluid gets squeezed into that cartilage like a sponge absorbing water. Stop moving regularly, and that cartilage begins to starve. It gets thinner, more brittle, and eventually starts to crack. That's osteoarthritis, and it's not something you inherit. It's something you allow to happen through neglect. Your metabolism is slowing to a crawl. The number of calories your body burns just to stay alive drops by 2 to 3% every decade after 50. That means the exact same diet and activity level that kept you lean at 35 will pack on pounds at 55. Your body changed the rules. You didn't get the memo, and your circulation is declining. Blood vessel walls lose their flexibility. Your heart doesn't pump quite as powerfully. Blood flow to your extremities weakens, which is why so many people over 50 complain about cold feet, nighttime cramps, and legs that feel like concrete by evening. Walking addresses every single one of these problems simultaneously. It rebuilds muscle, it feeds your cartilage, it revs up your metabolism, it forces blood through your vessels. The research is crystal clear. Regular walkers have dramatically lower rates of heart disease, diabetes, bone loss, and even dementia. But here's the part they don't tell you. All of that only happens if you walk correctly. Walk the wrong way, and you're not just wasting your time, you're actively accelerating your decline. Let me walk you through the 7 mistakes I see every single day in my practice. Mistake number 1, you launch into full speed immediately. Most people step out their front door and hit maximum pace within 30 seconds. It feels efficient. Why waste time easing into it when you could just get moving? But your body doesn't work like a machine. You can't just flip a switch and expect everything to fire at full capacity. Your muscles are cold and tight. Cold muscle fibers are rigid, which makes them vulnerable to tiny tears that accumulate over weeks and months into chronic pain. Your joints haven't distributed their lubricating fluid yet. That synovial fluid I mentioned earlier is sitting pooled in one area of the joint. It takes several minutes of gentle movement to spread that fluid evenly across the surfaces where your bones meet. Skip that step, and you're grinding bone on bone with every stride. And your heart isn't prepared for a sudden demand. When intensity spikes too quickly, your heart rate and blood pressure surge harder than they need to. After 50, when your vessels have already lost some of their elasticity, that sudden spike creates unnecessary strain on your arterial walls. The fix is dead simple. Walk slowly for the first 3 to 5 minutes. Not moderately, slowly. Almost annoyingly slowly. That's your warm-up, and it's non-negotiable. After 5 minutes, your joints are lubricated, your muscles are pliable, and your cardiovascular system has found its rhythm. Now you can pick up speed. Mistake number 2. Your posture is collapsing your spine. Go to any public park and watch people walk. 9 out of 10 are hunched forward with their heads jutting out like turtles, shoulders curled inward, eyes glued to the pavement. This isn't just bad aesthetics, it's biomechanical destruction. Your head weighs approximately 11 pounds. When it sits directly over your spine, your neck carries that exact weight. But shift your head forward by just 1 inch and the effective load triples. Push it forward 2 inches and you're asking your neck to carry 50 pounds of pressure. Walk like that for 20 minutes and you generate chronic tension through your neck, shoulders, and upper back. People blame this on sleeping wrong or stress. The real culprit is walking posture. There's a second consequence. When your chest caves inward and your shoulders roll forward, your diaphragm can't drop fully. Your lungs can't expand completely. You're breathing with only the top third of your lung capacity. Less oxygen means less fuel for your muscles and brain. You walk for 20 minutes and feel like you've been out for an hour. People think they're out of shape. They're not. They're just breathing badly. And there's a third domino effect. Poor head position forces your lower back to overarch to compensate. Your pelvis tilts forward, your knees operate at the wrong angle. Suddenly, you're loading your knee and hip joints unevenly, and that accelerated wear isn't aging. It's one correctable mechanical error. The solution is simple. Imagine a string attached to the crown of your head, gently pulling you upward. Not straining, just lengthening. Let your shoulders settle back naturally. Keep your eyes on the horizon, not the ground. Chin level, chest open. In this position, everything works the way it was designed to. Mistake number 3. You're walking in the wrong shoes. People obsess over where they walk and how far they walk, but they completely ignore what's on their feet. That's a catastrophic oversight because after 50, 2 things happen that make footwear critical. First, the fat pads on the bottoms of your feet thin out. These pads used to act as natural shock absorbers. Now they're diminished, which means every impact travels straight up through your ankle, knee, hip, and spine. Your shoes have to compensate for that lost cushioning. Second, the muscles and ligaments supporting your arch weaken. Your arch can start to collapse, a condition called acquired flat foot. This changes the angle at which force travels through your knee, shifts your hip alignment, and increases spinal strain. Proper footwear can slow or even prevent this process. What you need is adequate cushioning in the heel and forefoot, proper arch support that follows the natural contour of your foot, and a flexible sole at the front that allows your foot to bend naturally as you roll from heel to toe. One more thing, replace your walking shoes once a year if you walk regularly. The cushioning materials inside the sole break down long before the shoe looks worn on the outside. Wearing dead shoes is a direct path to joint pain. Mistake number 4. You walk once a week for a long distance instead of frequently for shorter durations. This is an incredibly common pattern. People are busy all week, so they take one massive walk on Saturday, feel accomplished, and call it exercise. Physiologically, this is backwards. Your body doesn't respond to one-time events. It responds to repeated, consistent signals. Every time you walk, your body receives a message that says physical activity is normal. In response, your heart becomes more efficient, your blood vessels adapt, your muscles strengthen, and your metabolism stays elevated. This is called training adaptation, and it only happens with repetition. One walk a week is too weak a signal. Your body never adapts. The benefit stays minimal. Worse, a single long walk after days of inactivity is a shock to unprepared muscles. They hurt the next day, and people conclude that walking isn't for them. The research is unambiguous. 20 to 30 minutes of walking on most days of the week is the minimum effective dose for cardiovascular protection. Not one heroic Sunday walk. 5 to 6 moderate walks spread throughout the week. Your body adapts only to what repeats. If you're currently walking once a week, start with 3, not 30 minutes. Start with 10. After 2 weeks, add 5 more minutes. Gradual progression isn't weakness. It's intelligent strategy. Mistake number 5. Your arms hang motionless at your sides. Most people either lock their arms rigidly, let them dangle, or jam them into their pockets. It feels comfortable, but it robs you of significant benefits and disrupts your movement mechanics. Walking is a whole-body cross-pattern movement. When your left leg steps forward, your right arm swings forward and vice versa. This cross-coordination is hardwired into your nervous system. It distributes load symmetrically across your spine and reduces twisting forces on your trunk. When your arms don't move, your spine compensates by over-rotating at the lower back. For people with existing back issues, this can trigger immediate pain. Second, arm swing activates the muscles of your shoulders, chest, and upper back. That means significantly more total muscle mass is working, which increases caloric burn, improves circulation, and amplifies metabolic benefits. Third, arm movement creates rhythm and improves coordination, which becomes especially important after 50 when balance systems naturally decline. The fix is effortless. Bend your elbows to roughly 90 degrees and let them swing naturally in rhythm with your legs. You don't need exaggerated pumping. Just stop pinning your arms to your body. After a few walks, you'll notice walking feels easier and more fluid. Mistake number 6, you're walking with your phone in your hand. 20 years ago, this mistake didn't exist. Today, it's epidemic. People walk while scrolling through messages, reading articles, watching videos, convinced they're multitasking their way to health. They're not. When you stare at a phone, your head tilts sharply downward. We already established what that does to your neck. The load on your cervical spine multiplies by 3 to 5 times. Your shoulders round forward, your chest compresses, everything about your posture collapses. Now consider safety. After 50, your balance system operates with slightly less precision. Your proprioception, which is your body's ability to sense its position in space, also declines. That means your brain increasingly relies on visual input to keep you upright and stable. When your eyes are locked on a screen, your brain is blind to uneven pavement, curbs, wet surfaces, and obstacles. The risk of falling skyrockets, and a fall after 50 isn't just embarrassing. It often means a broken wrist, fractured ribs, or a shattered hip. A hip fracture after 60 frequently leads to surgery, prolonged immobilization, and a rehabilitation process that can last months. The solution is absurdly simple. Put your phone in your pocket. If you want audio, use earbuds. Just keep the screen out of your hands. Walking isn't just physical exercise, it's neurological training. When you walk while paying attention to your surroundings, your breath, your body, and the sensations around you, you're actively training focus, coordination, and spatial awareness. That's documented cognitive benefit. Stare at your phone, and that benefit evaporates. Mistake number 7, you're ignoring recovery. Nobody discusses this. The general assumption is that walking is so gentle that recovery isn't necessary. That assumption is dangerous. Start with hydration. Muscle tissue is 70 to 75% water. Every biochemical reaction in muscle, including contraction, relaxation, and repair, happens in a fluid environment. Even mild dehydration, just a 1 to 2% drop in your body's fluid stores, measurably reduces muscle elasticity and increases cramping risk. After every walk, drink a full glass of water. That's not marketing, that's physiology. Now stretching. During walking, your muscles work in a shortened, contracted state. Afterward, they stay slightly shortened. Over time, this accumulates into chronic tightness and reduced joint range of motion. This is most noticeable in your calves, hamstrings, and lower back. 5 minutes of gentle stretching after each walk prevents this entirely, and rest days. Many people believe that if walking is good, more walking is better. That's not how adaptation works. Your body doesn't improve during exercise, it improves during recovery. That's when muscle fibers reinforce themselves, joints remodel in response to load, and your cardiovascular system upgrades its capacity. If you never allow recovery, adaptation never occurs. 1 to 2 rest days per week isn't laziness, it's the protocol that produces results. Here's the critical clinical reality. All 7 of these mistakes carry exponentially higher risk after 50 because your body's resilience has diminished. The same error your body forgave at 30 without symptoms will generate real damage at 55. How old are you right now? Drop your age in the comments. I want to know which age group is watching so I can create content that speaks directly to where you are. Here's what you do next. 1. Adopt the slow start rule. First 3 to 5 minutes of every walk, slow pace only. 2. Check your posture right now. Stand up, lengthen your spine, draw your head upward gently, ease your shoulders back. Memorize that feeling. 3. Inspect your walking shoes. If the soles are unevenly worn or you've had them for over a year, replace them. 4. Shift from 1 long walk per week to 20 to 30 minutes, 5 to 6 days per week. Start with 3 if that's all you can manage. 5. Let your arms swing. Bend your elbows and relax your shoulders. 6. Phone in your pocket for the entire walk. No exceptions. 7. After every walk, drink water and stretch for 5 minutes. Walking is one of the most powerful, accessible, and effective tools you have for protecting your health after 50. You don't need a gym membership. You don't need expensive gear. You just need the right approach and conscious habits. Small changes in how you walk produce massive long-term results for your heart, joints, brain, and overall vitality. Nobody in a standard medical appointment is going to teach you this. The system isn't designed for prevention, it's designed for treatment. That's exactly why this channel exists. Subscribe to Dr. James Whitemore, hit that like button, drop a comment with your age, and help us reach our goal. Your health depends on information like this. Let's make sure it reaches everyone who needs it.